Overcoming patient objections. When you're talking to patients about the cost of something, one of the things that can happen is the patient will make an objection. That's what they call it in sales. And an objection can be things like, oh, but, what if I don't do this? How long is it going to take? Any kind of question that they ask that might appear as though they're moving away from making a decision rather than moving towards. Here's the key insight. If a patient's asking questions, if they're making objections, that's good news. Why? Because it means they're engaged. A far worse scenario is where they don't ask anything at all. If they're not asking anything at all, it means they're probably not thinking about doing it, unless you've done an amazing job of describing to them what's going on. So if you hear objections, that's a really good sign. One of the things that can happen, especially as scientists, is that when a patient asks you a question, maybe it's a technical one, what you want to do, you feel like you want to go and just spew out all of this technical information. Rather than doing that straight away, if the patient asks you something that sounds like an objection, use these 3 words: tell me more. So resist the temptation, because what can often happen is they express an objection. You think, right, I've got the answer to that. Let me give you, the 1,000 reasons why that's not true. But sometimes what's happened is you are speaking to a topic that's not actually the question that they've asked. That's why you just say, oh, interesting, tell me more. And then they will clarify it for you, and then you've got a much better chance of actually handling that objection properly. Financing options. One thing I have to say for every dental practice is I recommend you have some kind of payment plans. Now, most practices do, and you've got a few ways of doing that, don't you? You can do it in-house depending on the treatment. You may let people pay in installments. Alternatively, you can have some kind of external financing. That's beneficial for a couple of reasons. The reality is, particularly for big ticket items, most people don't have big chunks of cash lying around. The second aspect is it allows you to bring the investment for this procedure into what they call breaking it down to the ridiculous. And so, for example, instead of saying, all right, Angus, so for this crown, it's going to cost you $2,000. If you get an inkling that the patient is perhaps a bit price sensitive, you can say, so Angus, we've got a way where you can pay this off, and it starts at $49 a week. And I can tell you from the patient's point of view, particularly when they've, in my case, got to go home and tell my wife, like, it's a lot easier for me to go home and say, hey, honey, look, the dentist told me I need a crown. It's going to be $49 a week. That's much more palatable than me going home and saying, hey, it needs to be $2,000. Now, a couple of other things to remember in this space. I personally never use the word price. I never use the word cost. Why not? Because those things focus on what it is that you're having to give. Maybe you've heard the expression pay the price or count the cost. It's got a negative connotation, particularly for something substantial. What I'd much rather you talk about, and I said it before, is your investment. So your investment in this tooth is ... The reason we use the word investment is, what does it focuses on? It focuses about a return. I mean, think about investing. If I invest in something, I'm expecting a return. That's much stronger language than talking about the cost or the price. I suppose a neutral term is fee. Maybe they don't have to make an investment in a $3 toothbrush, but I would argue it is an investment, isn't it? Could change their oral health forever. Useful phrases you can use. There's something that I learned many years ago. In fact, I've adopted this phrase, but it's based on my own experience. If you say it, it's debatable. If they say it, it's gospel. You remember before when maybe they're expressing an objection or asking a question, and I encourage you to use tell me more. What you should be doing there is listening intently to what they say, because what you can do then, and this is not trying to manipulate anyone, is to use the exact language that they've used with you back to them. Okay, Angus, so you've told me that what's important to you is ... And because you're giving their language back to them, it's gospel. And they will be going, that's right. They're nodding, they're thinking, and they're moving closer to a yes decision. Whereas if you say, well, I think what you should do is ... It's not that, you don't get trust as a healthcare professional, but there is an element of debate, and maybe you're speaking to an issue that's not actually the one that's in their mind. A couple of other phrases that you can use when you're talking to the patient about the treatment that they're considering. You can say, So what in this experience would be most important to you? Tell me about quality in this situation. Again, the idea is you want to get them talking about these things, because if they say to you, well, honestly, Angus, like quality is the number one thing, then that's the perfect example you can give it back to them when you're describing what they need to do. Common mistakes. Now, the truth is, as healthcare professionals, you are not trained in how to do what is basically a sales process. I know you probably don't like the sound of that, because I'm not in any way suggesting you be salesy, but the truth is, as the saying goes, if it walks like a duck, it looks like a duck, and it sounds like a duck, it's probably a duck. This is absolutely a sales process. The idea is not to manipulate the patient, but to influence them to make the best decision. So common mistakes that I see in this space is, one, assuming that cost is the real issue. In my experience, it usually isn't. It may be a factor, but as I've described in the B&W scenario, cost is typically not the number one thing. The second mistake that I see healthcare professionals make is answering that cost question straight away. It depends a bit on the context. I can tell you, if you've got someone ringing around for prices and they say how much for a crown, and you say that number straight away, if another practice down the road is $10 cheaper, you've almost certainly lost them straight away, because they're just not listening to it anymore. A much better way to do is to engage in the conversation that we've discussed, which is find out what's important to them, find out the medical condition, what's going on, tell me about it, how long has it been like that? Lots of empathy, use their name, etc., etc. A big mistake in that scenario is you do not want to answer that question straight away. The other mistake that I see is not offering any kind of payment plan. As I've said, particularly for big ticket items, the difference in the rate that the patients go ahead, if you say it's $49 a week versus having a much bigger number, that is day and night. A guy that I know, I'm not going to mention his name, but one of the biggest dental practices in Australia, and I asked him, how was he able to do this? And his comment was patient finance. I mean, we're not asking people to go and buy frivolous things. This is their health we're talking about. But for a lot of people, that concept of breaking it down to the ridiculous, so you realize your investment would be $49 a week, is much easier for people to go and talk to their loved ones and get the go-ahead. All right, as promised, because you've made it all the way to the end, I've got something very nice for you. If you check the link in the bio, the truth is we've got a whole bunch of free resources, which is my free gift to you. Finally, make sure that you like and subscribe so you can get more access to great material like this. Otherwise, see you next time.